Hi, I'm Ellen Yan, and welcome to Distance Learning Weekly, a new video series from GoGuardian. Every Thursday throughout the month of May, we invite you to join us in a conversation about managing mental health in the face of remote or distance learning. We have actually reached out to our partners and leaders in the educational community to join us in this series. And so each week we'll cover a new topic and hear tips and perspectives directly from these experts. In today's episode, we're covering the topic of mental health care for schools and administrators. And we are so honored to be joined by two special guests. First, Tracy Clements, licensed professional counselor and professional school counselor. She is the Director of Counseling Services at Neosho School District in Missouri. And she'll be sharing with us on-the-ground perspectives and approaches to keeping her students at Neosho safe during distance learning. And we also have Dr. Jonathan Singer, licensed clinical social worker, and he's an associate professor of schoolwork at Loyola University Chicago. He's also the president of the American Association of Suicidology and co-author of the 2015 Routledge text, Suicide in Schools, A Practitioner's Guide to Multi-Level Prevention, Assessment, Intervention, and Postvention. Dr. Singer is a well-regarded international speaker who's given hundreds of continuing ed workshops, keynote addresses, presentations on youth suicide, ethics technology, adolescent development, and attachment-based therapy, not only here in the US, but in Latin America and Europe. He's the co-author or the author of 65 different publications, with his research being featured in media outlets like NPR, BBC, Fox, Time Magazine, and The Guardian. So he'll be able to share with us today what he's seeing strategically across the country as it relates to suicide prevention in the face of distance learning. So thank you both for joining us today.
It's a pleasure. Thank you so much for having me.
Thank you.
Great. Let's start with Jonathan. Generally, how can schools remotely support the mental health and wellness of their staff?
You know, this is such a challenging time because we're all making it up, right? First of all, administrators are kind of figuring out how to remotely support staff, and staff are having to figure out what their limits are. Right. I think a lot of well-being happens during the school day because people see each other. They hear things that other people are saying. They walk down the hall to just catch a couple of minutes with their colleague. And you can't do that when you're stuck at home. Another thing that you can't do is you can't walk. Right? Teachers are used to wandering around the classroom. They're used to being active on their feet all the time. I mean, they want to get off their feet usually, but these days, folks are sitting all day, and that in and of itself is a stressor. And so I think that you're really finding different things for different stuff, which is the technical way of saying we're just kind of making it up as we go along. I think one of the things that school administrators can do is to make sure that there is a pipeline of information, right? Do teachers and staff know who to reach out to? Is there a way that they can do it in a confidential, supportive way so that if somebody says, I'm really having a hard time, it's not interpreted as you're not doing your job. It's just, okay, so this is another learning opportunity for us here, right? The idea that there are no mistakes, they're just learning opportunities. And so I would say that, be gentle and be forgiving, and make sure that folks are being creative with what they do and honest with each other. I think those are some good places to start.
Fantastic. And Tracy, Neosho School District in particular is quite I would say, a leader in suicide prevention programs at your various schools. What are the key components of success? And then secondly, to what extent did you need to adapt your protocols and procedures now with distance learning?
To begin with, when we were developing our suicide prevention plan, it started with support from the upper administration and the school board. So that was key. And once we had their support, I began looking for resources. And believe it or not, my favorite resource I found is Dr. Singer's book. So I developed our suicide prevention plan based on his book. And once we had the plan written, then we started training the various people. We had to train administrators, counselors, nurses, teachers. Um, and then we've implemented an ongoing training each year for all school staff. And then we utilize signs of suicide for student suicide prevention training each year. So we had all of that in place, and we utilize Dr. Singer's suicide risk assessment resources, which are wonderful. And we have been able to adapt those, kind of just hit the high points with those through virtual learning. We utilize Beacon, and so we get Beacon alerts. And when we call and talk to a parent, we can do those risk assessments online, or we can do a Zoom meeting, or we can just do them over the phone. So we've had to adapt a little, but overall, we're still basically using the same suicide plan, just in a little different way.
Great, it makes sense. And Jonathan, as we've been having some of these conversations with various administrators and schools, there's this concept of being able to protect teachers and staff themselves, even from the strain related to, like you were mentioning earlier, being remote and taking on multiple roles, like looking out for students' mental health and well-being. I guess what can we be doing to help?
Well, I mean, there are a bunch of different things that folks can do to address the kind of the mental well-being of staff. And I think one of the things to think outside of the box is to think about how are we structuring the school day. Honestly, so you have teachers who are supposed to be on from like 9 a.m. to 4 or 7 to 3 or something like that, and it doesn't give them the opportunity to have that downtime that they need to staff what's happening. And so if you think about it, I'm not suggesting everybody run out and change the school day just because I say so. But one way that you could think about it is what if high schools started at 11 a.m. and went until 2, right, or 3, and you had morning time when teachers and administrators could problem solve and say, hey, what worked yesterday? What's going on today? What's happening? Oh, we have internet outages. Oh, this didn't work. I saw, people kept changing their names on the calls, or they kept doing all these things. Like, what do I do? So like built-in problem solving, built-in teaching. And then afterwards, you can make sure that you have opportunities for mental health staff who are school based to say, hey, look, so this is what was going on in the classes. Can you go reach out? Can you do this sort of thing? However that works out, right? But it breaks it up, it concentrates it, and it makes sure that there is more contained time so that when you're teaching, and when you're staffing. And I think that would go a long way in helping people feel more supported. Now, I say this in part because I'm anticipating waves 2 and 3 in the fall and the winter, because that is what our scientists and our public health experts are predicting. So this is not something that I'm thinking we just have a couple more weeks and then it's the end of the school year and we're not going to ever have to worry about this. I think we will have to worry about this. And so that's why I think thinking outside the box, even when it comes to the school schedule, could be a really important way of helping support school staff as well as administrators to be able to do their job in an online environment.
Super helpful. And I'd love to hear, Tracy, how is NeoShow helping right now to maintain connections between the schools, the parents, the children, while also protecting the support, the mental health of teachers and staff?
Most of our teachers are making contact with their students at least weekly. They're doing Zoom sessions and phone calls, and the counselors are reaching out to students they were working with before the shutdown, and they're maintaining those contacts either through video calls or telephone calls, and emails. We're still making sure we're touching base with kids at least weekly. Our district office sends out updates that impact the whole district. So good communication there. Those come via email, text, and phone call. They're on our website, and we're also still delivering meals daily, and we will do that, I believe, through the month of June. So some of our most needy students are still having contact daily and having their food delivered.
Wow, fantastic. Um, Delving in a little bit more detail on a particular age group, Tracy, the teenagers, right? They often feel maybe the worst of the distance learning impact, especially in that they rely on their peers for help, and sometimes their definitions of self-worth and identity might feel like they're being taken away from them right now. What can schools and administration be doing to help this age group?
I think we need to encourage them to continue to interact with each other. Um, all of our students have access to a Chromebook, so they have the chat features through the Chromebook, and we are seeing more and more students setting up their own Zoom accounts and having Zoom hangouts. And so, several of them will get on a Zoom meeting and get together virtually. We're also seeing kids who are like they will go to a friend's house and just park in the driveway, and they will sit in their car. The other kids will sit in their car, so they're maintaining social distance and staying safe, but they still get to see each other. So I have really enjoyed seeing some of the creative ways that our kids are finding ways to maintain those social connections.
And it's about building that resiliency, right? Which is so critical in adapting to trauma.
Yes, yes. Connection is the foundation of building resilience. And right now, all of us need resilience. So connection is so very important, not just for kids, but for adults and administrators. And just if you're human, you need connection.
Absolutely. Jonathan, what are you seeing?
So one of the things that I'm seeing is I'm seeing more um, in terms of the crisis stuff. I'm seeing more family members, older family members in crisis, which has some trickle down for kids, particularly when kids have parents who are essential workers. There is really a sense that my parents, or one of my parents, or my only parent, is not available, literally has to go out, and when they go out, I'm afraid they're going to die, and that is an incredibly stressful time for kids. If you look at the stats from the crisis text line, which is 741 741, you see that the number of adults that are texting in for crisis help has increased significantly since pre-COVID times. You also see that more kids are talking about things like essential workers and stress and things like that. I think one of the flip side of the things that I'm seeing is that adolescents are having an opportunity to connect with their parents in a way that was hard before the shutdown. And there are a small subset of adolescents that are in dangerous home situations. So I'm not talking about those kids. Those kids, we believe, are in greater danger because of the shutdown, because there's less monitoring by other adults, there's less ability to get support. But for the majority of kids who have been busy, either because they were working after school, caring for their siblings, doing other activities, extracurriculars. They didn't have the informal opportunity to kind of hang out with their parents. And one of the things that we always say about supporting adolescents is that you want to be there when the adolescent is ready to talk to you. And if everybody's busy, and everybody is going off and doing their own thing, they can't do that. But this shutdown has made it possible for kids and parents to have that unstructured time together. And so, one of the other things that we've seen is when kids talk about things that are supportive, right? Things that are meaningful to them, they are increasingly using the word mom. They're increasingly using the phrase parents, not friends, not YouTube, right? They're talking about their family. And this is an amazing, amazing, totally unintended consequence of the shutdown.
That's pretty incredible. I do want to switch gears just a little bit and go back to the concept of trauma. And Jonathan, love to hear your perspective on the impact of trauma, not just on students, but teachers and the school administration during distance learning. We've heard about concepts of secondary trauma, compassion fatigue. How can teachers, staff, and parents kind of really help address this?
Yeah. There's a third kind of trauma, which we call shared trauma. And I think this concept is particularly important right now because a shared trauma is when the provider, the professional, is experiencing the same traumatic thing as the person that they're supposed to be providing services to. Famously in the United States, we think about teachers and therapists and emergency workers in Manhattan on 9/11. Right? They literally experienced the same traumatic event as the people that they were supposed to be helping. Um, Same thing with Hurricane Katrina in New Orleans. There are a lot of other examples, but for the first time in our lifetime, we are all experiencing the same event. Now, just to be clear, this is not a trauma in the sense of a capital T trauma, like you're being physically abused. Right? This is trauma, kind of lower T trauma, right, where there's this ongoing sense of the world is unsafe, and and so what we need to do is we need to remember that we are sharing an experience, and when providers, when teachers, when mental health workers are able to acknowledge with the people that they're supposed to be helping, students, parents, that they are affected by it too, it actually improves the relationship. So whereas we usually don't have teachers just sort of spilling about their days to their students, you don't have therapists who are like, oh my God, let me tell you what's going on, right? That's just not appropriate. In what's going on today, it is actually appropriate to acknowledge what we are sharing because it helps to build that sense of community.
Fascinating. Very, very good to know. And Tracy, I know Neosho has been utilizing trauma training. Can you speak a little bit to how you're bringing those principles to life with your school administrators and teachers?
Yes, we did a district-wide basic trauma training earlier in the year, which I'm so thankful that we had that done, because I've been able to remind them of those principles and kind of just remind them of the basic impacts of trauma and how it impacts your sleep and your ability to focus and concentrate. And I'm asking them to acknowledge those things in themselves and manage their level of trauma and then help students, because if they are still experiencing their own trauma to a certain degree, they're not much help for the students. So if they can manage it themselves and see what works, then they can basically give a testimonial to their students. Yes, I was having a hard time sleeping, and this is what helped me. I was able to do some deep breathing exercises or go running, um, and do a little bit of mindfulness, and hopefully they are using those principles and then sharing them with their students.
Fantastic. I'd like to kind of open up and see if there's any questions from the community here, and we'll kind of scan our Facebook group to see if there's anything that's coming in. But in the meantime, as we wait for that, Tracy, could you talk a little bit about some of the ways that you're kind of using techniques that are a little less stigmatized to try and help out get the adoption of mental health principles in ways that aren't just so that, because it's often a stigmatized topic.
Yes, so we have been talking to people a lot about keeping themselves mentally healthy. Um, there's a big difference between mental health and mental illness. And I think
Mm.
most people, when you say anything about mental health, they automatically think mental illness. So we have been working a lot with we have a district wellness coordinator, and she usually provides a lot of information about healthy eating and exercising. So we've been working together a lot and trying to group mental health in with physical health. So there are things you can do to keep your body and your mind healthy. And your brain is really just an organ in your body. So we're trying to package the two together so that people can understand that health is not just physical health, it's mental and emotional health as well.
Great. Jonathan, we have a question. Would love to get your take on this, which is, what are a few positive aspects of remote learning that can help equip us for the fall, as we might see wave 2 or wave 3?
Well, I think we've seen a lot of positive aspects of remote learning. One of them is it's started to debunk the myth that people can't be connected when they're online. We've seen with students as well as with teachers and adults and other folks that you can engage, you can listen to a lecture, you can watch a video, and you can have a simultaneous chat. And kids are really good at this, where if you prompt them and let them sort of let them know that you are interested in what are their reactions, what are their feedback, what are their questions, that you, instead of getting the same couple of kids that are extroverted and just want to hear themselves talk in class, that suddenly you get really interesting and in-depth conversation that happens between kids in an online environment. So that's one real positive. I think another positive is that we are kind of being reminded of the importance of being interactive in learning. And I think that there's an opportunity for school districts en masse to say, some of the products that tech folks have created might sound good on paper, might be shiny, the presentations might have been sexy, but you know what? These don't actually work. And as a school district, we're going to say no. We want you to do a better job for us, right? And in fact, we want to be involved from the get-go. So I think that there is an opportunity here to say, look, this is kind of a beta test. This was a run through for what's going to happen in the future. Whether it's because we're forced to with a pandemic or because we're choosing to, but we're actually going to do a better job next time with having e-learning. And not just for high school. We've talked about high school, but I mean, I have elementary school kids. E-learning for elementary school is pathetic. It's really bad. Like the programs out there, they're really, really, really suboptimal. And I say this with full love and compassion for the teachers that are trying to deal with this. But we got to do better if we're going to have second graders sitting in front of Chromebooks all day.
Gotcha. Yeah, totally fair. We have a question coming in from Twitter. And I'm waiting for it to come through on my screen, so I apologize. How can I find more local resources around mental health? Is that something that
I'll just jump in real quick. So
yeah.
So let me just say, there are a couple of things that you can do. First of all, you can always call, you can text crisis text line. You can call the National Suicide Prevention Lifeline. You can go to a place like auntbertha.com and search your zip code, and it'll give you a list of resources in your area. You can I think a lot of places have 311 set up where you can call to get information about resources. So there are lots of different ways that you can find that out. If you have insurance, look at the back of your insurance card and call that 800 number or 888 number and say, I need to talk to somebody. What's true is that third-party payers would much rather have you be involved in online or telehelp than end up at a hospital. And that's always true, but it's definitely true right now. So people are particularly motivated to get people hooked up.
Perfect.
And I
To
would like
wrap
to
up,
jump in there too and
Tracy,
say, I'm sorry. I would like to jump in there and say most school districts maintain a list of local resources, and they will know more about the providers and what kind of services they provide.
Fantastic. And on that note, would love to just get closing thoughts from both of you on what you would share with our school administrators as they support their students. We'll start with you, Tracy.
I think one of the biggest things to remember is connection is the foundation of resilience. So administrators need to maintain connection with their teachers and encourage the teachers and school staff to maintain connection with the students and just be patient and supportive. Like Jonathan said in the very beginning, we're making this up as we go.
Perfect. Jonathan?
Yeah. So One of the things that I would say is that, because I totally agree with what Tracy said, I think that the other side is to see this as an opportunity to find what are the gaps, right? What are the things that have been in place that don't work online, or what are the things that have been in place that just didn't work for us really well in the first place? And now is an opportunity to make some changes. And this could very well be that you're a school, and the community looks to you to be everything, and you're not, and you can't be. And so maybe it's really shining a light on that right now. And so you're like, look, when things open up again, or when it's fall or winter, we have to say, look, we can't be everything for everybody. And so where are the other places that we can build up our service system, right? What are the other systems that can address these issues? And to see this as an opportunity to get that information from teachers, from parents, from students, so that it is, as administrators, you can have that kind of 10,000 foot view of what's happening, so that the next time this goes on, it's better for everyone.
Great. Well, thank you so much, Tracy Clements from Neosho School District and Dr. Jonathan Singer, for your insights as well as resources. So actually, if you all want to check out the links below this video, you'll find helpful information that both Tracy and Jonathan have been so wonderful to curate for us and this community. So please go check them out, and thank you for joining us. We will see you next time right here on Distance Learning Weekly.